Chapter 6. We're going to learn about more effects and benefits and indications and also contraindications of massage. So when to do massage, when to not do massage. I don't know what this thing's doing. Let's X this out. There. Massage has a lot of effects on the body, as we just kind of briefly went over. There's physiological effects. Muscular system is affected. Nervous system. Our neurotransmitters. It's a pain reliever. I forgot the R here. Circulatory system, and also can affect the body psychologically. Let's dive into each one. So, physiological effects. There are two physical effects that can occur separately or together. You have your mechanical effect and your reflex effect. So your mechanical effect was that effect that I was talking that was direct, that is just we're touching the skin and things are sort of happening on a physical level. Mechanical effect, direct physical effect on the tissues that they contact. So the first thing you think of is somebody is having some tension in their shoulders, like a loved one, and they say, will you massage my shoulders real quick? And you do the little squeezy thing, right? The squeezing is your mechanical effect. You are squeezing the muscle with hopes that it kind of softens and feels less painful. The reflex effect happens after your mechanical effects. You touch somebody and then there starts to become a reflex effect. This is an indirect response to that touch. You touch somebody, now something else is happening within the body. It can affect the body functions and tissue. It can affect you neurologically or the energy systems of the body. Now, the Chinese cultures and the Indian cultures are really big on energy. Remember that chi, that energy, that life force energy we were talking about last week a little bit? They say that with physical touch, it can also affect your energy levels. And I'm not just talking about you're feeling tired, but supposedly we all have energy points in our body, and if those are stagnant, that's when disease happens. So that's the purpose of like energy work or some reflexology, because it has the mechanical and reflexive effect. So effects on the muscular system. We have both effects happening to the muscles, right? First thing, we have enhanced local fluid uptake in the muscles. This is good, all right? When we are massaging the muscles, more blood and lymph and oxygen and nutrients go to that body part so that it heals faster. Massage can deform sensory or proprioceptive nerve endings. So it can kind of calm down the nerve endings so that things aren't firing and causing more pain. Massage stretches and also compresses the muscles and the connective tissue. So last week I had you guys doing compression moves on each other. That is a mechanical effect that then will soften that muscle because you're pushing against the bone, right? Regular massage can relax and reset muscle tone, which is big for healing and big for recovery. That's why it's so widely used in like the Olympics. It causes something called hyperemia. This is increased blood to the area. So hyperemia would create reddening and a warmth to the area, which is good. It's kind of a localized inflammatory response. So a little bit of inflammation is good. A lot of inflammation is bad. Massage helps relieve stiffness and soreness. It promotes cellular repair. It can also reduce scar tissue formation or kind of break down the scar tissue and make it more soft, all right, more pliable. And then with time, it can also increase the range of motion within a muscle. A lot of effects. The nervous system. So massage also affects the nervous system. It's big on affecting the nervous system. Because the nervous system depends on direct and reflexive reactions to stimulate the nerves or to calm the nerves. There are some techniques we're going to learn, but just for fun, I want you guys kind of keep in mind that there's stimulating effects. Something called friction, percussion, and vibration would all be stimulating, right? Think of friction, you rubbing your hands together, you're creating a little bit of heat, right? And it's stimulating. Think of like, have you guys ever experienced like a cat or a dog giving birth and you had to help and kind of warm up the baby to get it breathing, right? That would be a stimulating effect. We're trying to get things moving, right? Percussion. A technique in massage that we use is percussion, although not a lot. Think of percussion as we'll do the karate chop, all right? So those quick kind of like taps on the body can stimulate the nerve endings. And then vibration. Has anybody ever had like a massage gun or stood on those vibrating things and then you start feeling itchy, right, in that spot that's vibrating? Well, that's because it's stimulating the nerve endings. Then we have sedative techniques. All right, so the techniques that would be sedating would be gentle gliding. We're just relaxing. Very light friction and very light kneading. And compression can be sedating. All right, so we had the nervous system. Now we're going to break down the nervous system into something called the autonomic nervous system. The last thing we just went over with the wildebeest and the lion and the fight or flight. All right, we're going to be talking about the sympathetic nervous system a little bit. That's fight or flight. And the parasympathetic, that's rest and digest. And this is not the first time we're going to talk about this. So if you don't get it the first time, you're going to eventually get it. I will shove fight or flight and rest and digest down your throats. Sympathetic nervous system. This is the initial alert to your nervous system, right? And it has energizing effects. An example of this massage techniques that would be sympathetic would be a sports massage, right? And chair massage doesn't tend to be super relaxing and chill, all right? And sports massage is directed on, it's a little more fast-paced, and it's based on enhancing an athlete's muscles to do better in a game, right? Or afterwards. Then we have the sympathetic nervous system, rest and digest. I mean the parasympathetic, sorry. When I think of ways to remember the two, think of a parasite. What do parasites do? They eat on a host, right? So that is rest and digest. So if you can't remember which one's fight or flight and which one's rest and digest, it's think of which one is a parasite eating, right? Parasympathetic nervous system. It counters the effect of the fight or flight or the sympathetic. This is what we want during a massage typically. We want the parasympathetic nervous system to engage. All right, a lot of strokes would be longer, more relaxing strokes. All right, those tend to relax the sympathetic nervous system because we're trying to get you out of fight or flight and get the cortisol levels down. All right, and this allows for the body to rest and repair. Massage also has effect on the neurotransmitters in the body. It increases levels of serotonin, dopamine, and endorphins. All right. Serotonin. What do we need that for? It is basically a mood regulator. So a lot of people who tend to have anxiety or depression issues, they might be on a medication that kind of boosts your serotonin a little bit. They call those SSRIs, right? It also plays a part in behavior, appetite, blood pressure, temperature regulation, memory, and learning ability. So if you're lacking serotonin, you might be having issues with some of these things. You can also have too much serotonin. That's not good either. All right. Then we have dopamine. What's dopamine for? It controls fine movement. It controls your emotional response. And it gives you the ability to either experience pain or pleasure. Then we have endorphins and I can't even say it. Enkelefins. Enkelefins. There we go. These are mood elevators and natural pain killers. So the endorphins, they're getting pumped through your body because of massage. You're going to have that lasting effect of like a natural pain killer. Enkephalins. There you go. Sometimes I look at the word and my brain's like, I'm good. I don't know. All right. Effects of pain. We have something called gate control theory. Massage interrupts the transmission of pain sensations going through the central nervous system. So with gate control theory, you tend to only be able to focus on a certain amount of pain. So sometimes somebody may be threw their back out, and that is their main pain. Right? The body does this on purpose and kind of protects us from feeling too much pain at once. So think of, I don't know, a burn. Maybe somebody, I know this is really tragic to think of, a burn victim that has burns totally throughout the body. After a while, you're only gonna, you might not feel anything after a while if the nerves are affected. But after a while, only certain things your body's gonna be able to focus on at a time. Central sensitization. All right, so massage can help with the condition of the central nervous system, which is associated with the development and the maintenance of chronic pain. So massage stops the pain in a way, temporarily, right? And then can also prolong pain relief by giving you those endorphins. Massage is awesome. Massage has an effect on also the circulatory system. It actually has a huge effect on the circulatory system. This increases the quality and quantity of the blood flow. Right? Because of this, we have better cellular nutrition and better eliminations. So getting rid of the bad guys better. Massage can temporarily reduce blood pressure and the heart rate, kind of calms it down, all right, brings it into parasympathetic, right, state. The capillary beds dilate and become more permeable. So that means the capillaries are opening up and allowing for things to flow and receive, right? There is an increase in your red and white blood cells. This is also big, so it could increase your blood cell count, right? It also increases the presence of T4 killer cells into the bloodstream. We need these to fight off infection. So those people who have HIV or AIDS tend to have a low T count. Have you heard of that term? That's what we're talking about, those killer T cells. So they have a harder time fighting off like some kind of dysfunction, like a viral or bacterial fungal infection, something like that. Massage also aids in the flow of the lymphatic system. We need our lymphatic system to carry out, it is basically our immune system, right? So increases the immune system, increases blood cell count, Makes your body, your capillaries more permeable. Some psychological effects. Touch can actually help rebuild a more positive self-image and self-worth. I like to use seniors as an example here. Sometimes seniors are widowed, and maybe that massage is the only touch that they get now. So think of it that way. It's very sad to think of it that way, but it might actually help just their mental clarity overall. It reduces aversion to touch for physical or sexually abused victims. Reduces anxiety and depression because of, remember, serotonin, dopamine spikes. Very temporary, but awesome. Promotes relaxation and mental awareness. Some conditions that are generally relieved or improved by massage would be stress, big one. Insomnia helps with that. Fatigue, mental or physical. Muscle and joint pain, it can help with your muscle tone. Now, you can't just get a massage and expect the same results as the gym, but it can help with muscle tone over time. Muscle spasms, headaches and migraines, which is also in the pain category. It helps digestion, because massage not only, remember, we have the reflexive or the mechanical effect. We have that reflexive effect that's going to now start the systems of the bodies, get them functioning. So sometimes you'll notice after a massage, somebody might need to have a bowel movement. That is really normal, right? It's because things are moving and functioning better than they were before they got their massage. Range of motion tends to be better, and there's a lot more conditions that can be relieved by massage. We're going to learn all about that when we do pathology. Some common contraindications. This is when you want to be cautious or not give massage at all. High blood pressure, only if it's uncontrolled. A lot of people have high blood pressure, and a lot of people take medication for it. As long as it is in a controlled state, massage is fine. Fever, big one. Shock. If somebody's in shock, I would not be starting some massage on them. But hey, I just feel like that's just a common one, right? Acute infectious disease. So that means if they're in the beginning stages of a cold or flu, in the contagious stages, because they are healing, and also you don't want them spreading infection, right? Toxemia during pregnancy. We're going to learn all about contraindications with pregnancy, because when you're pregnant, you can get a massage. But we're not going to do that right now. We're going to learn that when we do prenatal. Contagious disease. So if they have some kind of contagious disease, either you're going to not work on them or you're going to make modifications. Like if it's a locally contagious thing, avoid that area. Open wounds. It depends on the wound, right? And how infected it is. If they have a tiny little cut and they have a little Band-Aid over it, you can give them a massage. Just don't work on their cut. Does that make sense? If they have a gaping open wound that's infected and pussing, I would call that a systemic infection at that point, and tell them once they're past that really bad infectious stage, they can proceed with massage. Also, avoid that area until it heals. Acute inflammation. So if there's swelling, redness, heat, pain, we get people like that. But if they literally just rolled their ankle coming to your massage place and everything's swollen, and you're like, I'm not sure if that's broken or not, do not work on that ankle. I would tell them to go to the doctors anyhow. Be like, you need to go. Where am I at now? Osteoporosis. So somebody who has osteoporosis tends to have more frail bones. So as long as they get doctor's approval, or you give a very light Swedish massage and not like some deep tish on like poor little grandma with osteoporosis. Just be mindful that you can break bones if you push too hard on somebody who has very, very frail skeletal system. Varicose veins, not to be confused with spider veins. Varicose veins, we'll learn, are the big, thick veins. Most people get them on their legs. If they have varicose veins, we are not to massage over that area, because we can, if there's a blood clot that we don't know about, release that and kill them. So, no to varicose veins. Phlebitis. This is inflammation of a vein. They're going to have a lot of pain, so they're going to know. So just avoid that area, or refer them out. Post-surgical sites. We do work on people post-surgical, but after they get to the point where they can receive massage safely again. A lot of it we'll be working on scars, kind of lighten up the scars and increase mobility, range of motion, and decrease pain. So just don't do it too soon. It depends on the situation. A lot of times if you don't know, just tell them, I need a release from your doctor. A hematoma. All right, have you seen the bruises that have a lump in them? Don't work on those. Those aren't knots. Right. We don't want anything bad to happen with blood clots. Edema or lymphedema. If somebody has swelling caused from lymphedema and you don't know what you're doing, don't touch them, because you could kill them. Another way you can kill somebody. It's not gonna. Most people, it's not that serious, but I would advise sending them to somebody who has lymphatic draining education. We are going to learn lymph massage, but if you are not comfortable working on a situation, don't work on them. All right, cancer. Now, this is on the list as a contraindication, but you can receive massage if you are currently, or if your client has cancer. You're not going to spread cancer cells via massage. That is not how cancer cells work. And typically, at this point, it's more for quality of life than it is for thinking of any dangers that it might cause. There are courses on oncology massage, so it is safe. Just be careful what the cancer is. Like if they're, I don't know, say they have thyroid cancer, I wouldn't work on them until things are, they're in like a recovery type phase and stuff like that. But it's really up to you and what your experience is. Intoxication. So massage has that mechanical effect, or the reflexive effect in the body where things start speeding up, right? If somebody is intoxicated, think of all the toxins that their liver is now trying to sift through from the alcohol. You are now speeding up everything in the body, so now that liver is going extra hard to try to get rid of the toxins from all that alcohol they just had before they came into you. You can literally kill them if they're intoxicated. Now, I'm not talking about like they had a beer or two and came and got a massage to relax. I'm talking about like totally intoxicated. Do not work on somebody. I did have somebody come in once. I laid him down and called his wife. I gotta give it to him. His buddies dropped him off. He was on time for his appointment. I don't think he hardly got up my stairs. And then he went missing in my office, and I found him in a random dark room sitting in a chair. So I said, let's just lay down. Called his wife. She was mortified. It was awesome. He doesn't remember. So that's what I'm talking about, intoxicated. Like, if you're that drunk and you're not going to remember the situation. All right, pregnancy is on the list only if they're high risk. A lot of massage therapists refuse to work on women in their first trimester and wait till second. It just really depends on your preference. I do like to wait till we get closer to the second trimester mark, just because most people, if they're going to miscarry, it's going to be in the first trimester, and we don't want to be blamed for that. Makes sense? Now, we're not going to miscarry a baby giving someone a light massage, but still we want to be cautious and protect our license, our reputation, and whatnot. Severe skin conditions. If somebody has a severe skin condition, their skin is compromised. All right, you can spread infection, or maybe their condition is contagious. So we're not going to work on somebody who's having really bad reaction of some sort. A hernia. We're not working directly over a hernia, right? It's going to make it worse. It's not a knot. It's a hernia, all right? So we want to take precaution, this bottom part here, when clients are taking certain medications, such as blood thinners and pain medication. Why? If you are on a blood thinner, you can bruise easier. So a deeper massage, they're going to look super battered. And then with a bruise, you have to now heal from the bruise. So the body's going through a little bit too much after the massage. So if somebody is taking blood thinners, be mindful of your pressure and your technique. You can still work on them. It's fine. And most of the time you'll know because they put it in their intake form, which we will make them fill out. Pain meds. We have a lot of people who come in on pain medication. Also, we're going to be kind of cautious of our pressure because pain medication can alter your perception of touch. So what they might think is, oh, you can go deeper, is, no, I can't. Your muscle is twitching. You need to calm down, sir. Right? So pain meds, like I said, can alter that touch, and they might not feel it. You don't have to go as deep, all right, as they think that you need to go. So be careful of those things. And you might also notice, it's not on here, some people will have ports or colostomy bags and stuff like that. You just need to work around. All right. Endangerment sites. This is important. There are certain spots on the body that I'm not trying to scare you guys. We want to avoid. Not fully. You can still lightly go over the area, but I'm talking about with firm pressure and holding points. We're not going to want to do that with any of these endangerment sites. So endangerment sites on the head and neck. We're going to talk about the inferior part of your ear. You're like, I don't know what that means. I'm going to tell you in a second. We have the anterior triangle of the neck and the posterior triangle of the neck. So inferior means below, like I am inferior to you or whatever. There's a spot, if you go under your ear, that's a really soft spot just under your ear that you don't want to put a lot of pressure in, because there's this tiny, tiny little bone called the styloid process that you can, if you push really hard, possibly break. I'm going to show on Jack over here his little styloid process. Get your cat off. Not many of you can see, but this tiny little bone right here is the styloid process. So if I were to put too much pressure here, I mean, it's probably pretty hard to do. You could break that bone. Come on, sir, your head is crooked. Thanks. Now we have something called anterior triangle of the neck. When we are talking about the body, we're going to start talking about the body in terms of directions, like medical directional terms. Anterior is going to mean the front of your body. Posterior is going to mean the back of your body. Think of somebody putting a kick me post-it note on your back. Posterior is back. So anterior triangle means if you turn your head and you feel this little lumpy muscle here, this is called your SCM. Right in front of that, between your throat and this muscle that when you turn you can feel, this little soft spot is called your anterior triangle of the neck. The reason why we are not going to really work in that area a lot is because it holds the carotid and the carotid artery and the jugular vein. Your client will pass out. Have you heard of like the wrestling poses where they like just kind of block off, or they put you in a headlock and you just pass out? I mean, yes, you're losing oxygen, but also it could be from the carotid artery or the jugular vein. You're just losing blood supply to the brain, just down for the count. Now, we are going to start working close to that area, but my advice to you is if you feel a pulse, lighten up the pressure. All right? All right. Posterior triangle of the neck. Now, it's not really posterior, all right? But it's kind of this section in through here. You have this soft spot right here, right? And you can kind of feel it if you raise your arm up and then you can kind of get underneath. That is considered your posterior triangle. The reason why we're not pushing our fingers deep into this area is by the way, most of these endangerment sites, it's because of nerves, lymph nodes, and like veins or arteries. That's the main reason why we're not doing a lot of pressure here. For this specifically, we have something called the brachial plexus. It's a bundle of nerves. Then we have another artery, and then we have lymph nodes. So we just don't want to cause damage to any of these areas. We really don't want to cause nerve damage to our clients. That would be bad. That's when the liability insurance kicks in. Endangerment sites of the arm. So these again are going to contain lymph nodes and major nerves for your arm and your forearm. The first one is the axilla. That is armpit. So you're not going to be doing a lot of pressure in the armpit until I show you how to get to different muscles through the armpit. Right? And again, we're going to be careful of where we're pressing. So this whole armpit area is considered the axilla or the axillary area endangerment site. Then we're going to have something called the medial arm. It's just this soft spot, okay? So yes, we can still massage here, but we're going to be very, very cautious of how hard we push down here, okay? So you have your bicep, this big muscle that everybody knows about. Just below that is going to be the soft spot, which they call the medial arm. All right, the part, if you were to stand like this, that is up against your ribs is going to be the tender endangerment spot with lots of nodes and nerve bundles. The cubital area is the inner elbow. All right, so this soft spot where they tend to draw blood from is an area we're not going to do a lot of pressure on. The back of the body, so posterior view. We have something called the medial brachium. You're like, what? So that is that soft spot. So I was like this, right? So the inner part of the arm. If I were to just turn over, it's the same spot as that last slide, that inner soft part of the arm. It's just, you can also get to it from the back. So brach means upper arm from medical terminology. So that is the medial, which is midline brachium. Now we have our lumbar area. We're not going to do a whole lot of pressure in this area because of the kidneys. I'm going to show you on this guy real quick. Turn you around, my sir. His hair is wild. So the kidneys are going to be in here, all right? If we push too hard in here, we can also affect the kidneys. We're not trying to bruise anybody's kidneys while doing massage. So also we're not pushing that hard anyhow because we have these two floating ribs here that we can break. So, and as we start learning how to apply touch, we're going to learn that we can work on that part of the back just very lightly. We're not going to be doing deep tish into the floating ribs. So we also don't want to break that rib and have it puncture a kidney. I mean, I feel like that's really reaching far, but hey, if any of you have really bad luck, you never know. Then we have something called the ulnar notch. Your funny bone. You know when you hit that end of your elbow? That's what we're talking about, is the ulnar notch. That is your funny bone. That hurts like a son of a gun, and nothing is funny about it. But that's what we're talking about, all right? So kind of this soft spot here. If I were to jam my finger in here, your finger, like your last two fingers, pinky and ring finger, are going to get tingly and numb. That's the ulnar nerve getting pinched. Another big spot back of the knee is the popliteal fossa. So like I said last week, don't do the cubital, so inner elbow, or the back of the knee, the popliteal fossa. So the main reason for that is you have the tibial and common peroneal nerve, and then we also have arteries and veins. All right, some other anterior view. The femoral triangle. Now, most of you aren't going to be working on anybody's groin anyhow. So this is that soft groin area, right, where your pelvis and your leg meet on the inner leg. I'm going to zoom so you can see it a little bit better. Right in here. This is a very sensitive spot. There's a lot of nerves and veins and arteries going through there. So we're not going to do that. Now, if someone were to be bleeding, maybe their quad is bleeding, that is what we're going to want to cut off circulation to. That's when you rip your shirt off and then tie it around the upper leg and kind of cut off the supply of blood. Abdomen. We're going to learn abdominal massage. It gets done very rarely. But the reason why we do abdominal massage is to help with digestive issues. Right where the actual stomach is where we're not working. We're going to be doing, intestines and stuff like that. So we don't want to work very, very high up. There are a lot of organs in that region. Upper right would be liver and gallbladder. Upper left would be your spleen, and right dead center would be your aorta. We're not going to want to mess with any of those structures. Now that you guys are fearful of touching, all right, I'm going to take a little break, and then we'll join back. Come back at quarter till. Am I still recording? Yes, I am.